brain is definitely one of the most important organs that are affected by heart failure. There are two main problems deriving for brain that are cognitive impairment and stroke. My presentation today will be particularly focused on stroke, since I am the director of the emergency department stroke unit of this hospital. We know that heart failure is a risk factor for stroke, because we know that in 1 year after diagnosis of a heart failure, 2% of patients have a stroke, and 1 to 10% of patients in the subsequent years will have a stroke. But less is known about the impact that heart failure as on stroke immediately in a short-term outcome and in a long-term outcome. There are a few studies on this argument demonstrating in particular in higher mortality, in-hospital mortality, but no information about, for instance, neurological impairment or long-term outcome. We have performed, for this reason, a study on a group of about 280 patients admitted to my stroke unit, in which on 30% approximately of them we diagnosed heart failure with moderated or importantly reduced ejection fraction, and we have seen a very higher mortality as compared to a patient without heart failure and a neurological impairment during hospital stay. But we also have found that in an average of 2 years of follow-up, approximately 20% of them had mortality for all causes, and 15% of mortality due to cardiovascular causes, while the rate of stroke recurrence was not significantly increased as compared to patients without HF. This means that HF, particularly if combined with atrial fibrillation, which may happen in up to 50% of patients, has to be tackled as strongly as possible by neurologists and cardiologists working together in order to improve the short-term and long-term clinical outcome of stroke patients.